Can you tell me who you are?
Sarah Slayton.
And what time of day is it?
Around 10 a.m.
And where are you at?
The hospital.
Okay, and I'm going to have you count from 0 by 7s. I'll tell you when to stop.
Okay. 0, 7, 14, 21, 28, 35.
That's good. Okay. I'm going to start by inspecting the skin. I'm going to look for any rashes, any lesions, any wounds. I'm going to look for hair distribution, make sure it's distributed evenly. I'm going to check for any kind of psoriasis, any dryness on the skin, things like that. Let me see your hands. Okay. All right, and can you put them together like this for me? Perfect. Okay. Let's see this. I'm going to look for any edema noted on the legs, the feet, the hands, and the arms. I'm going to start by inspecting the scalp. Go ahead and put your head down for me. I'm going to look and see if there's any lesions, abnormalities, any kind of dandruff, things like that. All right, I'm going to start by looking at the head. I'm going to look for some symmetrical ears, eyes, look at the nose and the mouth. For the eyes, I'm going to inspect the eyebrows, the eyelids, the eyelashes, the sclera, the iris, the pupil, and the conjunctiva. Okay. Any pain?
No.
How about here?
No.
Okay. All right, I'm going to have you close your eyes, and I'm going to try to take them apart. I want you to hold them together. Okay. Don't let me lift them up. Okay. All right. I want you to smile for me. All right, and frown. And stick out your cheeks. Puff out your cheeks. Okay. And act like you're going to whistle, but don't actually whistle. Okay. I also want you to open your jaw for me. All right. I'm going to have you close one of your eyes. I'm going to look with this pen light. Just stare at me, okay? I'm also going to have you look at this door straight ahead. My finger is going to come towards you. I want you to focus on my finger now, okay? Focus on the door and then look at my finger. Okay? And then I want you to take this card and I want you to read the lowest line you can.
63925.
All right, hold one eye, yep, and then do the other one.
63925.
Okay.
63925.
Perfect. Okay. I'm also going to have you follow my finger, okay? Okay. I want you to close your eyes for me. You're going to feel this.
Okay.
And tell me when you feel it, okay?
Okay. Yes. 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 Yes.
Okay. All right. I'm going to bang this tool. I'm going to put it on the top of your head. I want you to tell me if you hear it equally in both ears, or if you hear it better in one or the other.
Okay. Equal.
Okay. I'm going to bang it again. I'm going to put it behind your ear like this. I want you to tell me when you no longer hear it, and then I'm going to move it to the front. I want you to tell me when you no longer hear it.
Okay. I can no longer hear it. I can no longer hear it.
Okay. I'm going to do the same thing to the opposite side.
I can no longer hear it. I can no longer hear it.
Okay. All right. I'm going to look inside the ears, any drainage or any lesions or anything noted in there. Look at both sides. I'm going to look inside the nose, look for any deviations, anything like that, any drainage. I want you to open up your mouth. Say ah for me.
Ah.
Okay. I'm going to look inside the teeth. Put your tongue back inside. Let me see your front teeth. Okay. All right. I want you to stick out your tongue. I want you to move it side to side. All right. Perfect. I'm going to start looking at the neck now. I'm going to look for symmetry, look for any thrills, look for any pulsations up there. I'm going to palpate. Any tenderness up here?
No.
Okay. All right. I'm going to feel the trachea. See if it deviates to one side or the other. Okay. I'm going to give you a sip of water. I want you to hold it into your mouth until I say swallow, okay?
Okay.
Go ahead, take a sip. Go ahead. All right. And again. Go ahead. All right. I'll put it back for you. All right. Now I'm going to start by looking at the chest. I'm going to look for symmetrical breathing. I'm going to look for rhythm. I'm going to look for AP diameter. Okay. I'm going to palpate and look for any crepitus, anything like that. No pain when I'm pressing here?
No.
Okay. I'm going to take my stethoscope. I'm going to listen to you. All right. Deep breath for me. Okay. Okay. Listen from the back. I want you to tell me if you feel any pain here, okay?
No.
Okay. Any pain here?
No.
Okay. I'm going to look for bronchophonia. That's when I'm listening to the lungs. If I hear any abnormalities, I'm going to have the patient say E, and that's going to look for eophony. And then for the whisper, I'm going to have them whisper and feel if I feel any abnormalities. Okay? So go ahead and say E.
E.
Okay, and whisper. Okay. All right. Now I'm going to look at the heart. I'm going to look for any pulsations on the chest. I'm going to listen. Actually, I'm going to palpate. Just feel if I feel anything. The aortic valves on the second right intercostal space. The pulmonic valve is on the second left intercostal space. The second pulmonic valve is on the third intercostal space. The aortic valves on the fourth intercostal. This is all on the left side intercostal space, and the mitral valves on the fifth midclavicular line. Okay, now I'm going to listen. I'm just listening to your heart. You don't have to deep breathe. Okay, I'm going to listen with my bell. Okay. Now I'm going to have the patient lay down. I'm going to inspect the abdomen. And have her empty her bladder before we do this. Have her lay down, put her arms flat to the side. I'm first going to start, I'm going to move these down just a tad. And I'm first going to start by listening. Okay. I'm going to percuss. And we'll feel a light pinch. Okay. I'm going to lightly palpate. Any pain?
No.
Okay. I'm going to deeply palpate. Any pain?
No.
Okay. I'm going to have you take a deep breath and I'm going to palpate deeply, okay? Go ahead. One more. Okay. Also, when I'm inspecting the abdomen, I'm going to look for any scars, any abnormalities with any deviation to one side or the other of the abdomen. While I have her laying here, I'm going to check her musculoskeletal. I'm going to have you take this leg and pull it out and lift it over the other leg. Okay? And do the same with the other side. All right. I want you to lift your knees up to your chest. Perfect. Perfect. Okay. I'm going to push. I want you to pull up. Okay. And do the same with your feet. Pull up. Okay. And perfect. Okay. You can go ahead and sit on the side of the bed. I'm going to have you stretch your shoulders up. Stretch them down. Put them out. To your body and away from your body. Okay. I'm going to have you lift up your head. Down. Side. Side. And ear to shoulder. Ear to shoulder. Okay. I want you to put your elbows up and down. And out. Okay. I'm going to push down on your arms. I want you to pull up. Okay. All right. And then same with your hands. Okay. Okay. Put your hands in and out. In your wrist, twist them. Okay. I'm going to have you stand up for me and bend and touch your toes. Perfect. And then twist your abdomen. All right. And you can go ahead and sit back down on the bed. And I think that concludes it.
Yes. I feel like I'm going to pass out. Oh, wait. Oh, I'm so sorry.